We've been working for the past 20 years to learn more about a long-lasting syndrome that many people experience after a traumatic brain injury called BIAFAC. Some of the symptoms include fatigue, depression, anxiety, memory issues, and sleep disturbances. We've learned that this syndrome is tied with a reduction in growth hormone that is secreted by the brain. People living with BIAFAC experience dramatic relief from their symptoms with hormone replacement therapy. The trouble is that BIAFAC returns if the treatment is discontinued. The hormone is expensive and not always covered by health insurance for the long term. So we're trying to better understand BIAFAC and exactly how and why growth hormone replacement works so well in order to develop new treatments. We've recently published a new study in the Journal of Neurotrauma that provides new insight on this. We noticed that TBI patients had altered amino acid and hormonal profiles that suggest chronic intestinal inflammation. So we looked into the role of the gut-brain axis in the long-lasting effects of TBI. We compared the fecal microbiomes of 22 moderate to severe TBI patients living in a long-term care facility with 18 healthy age-matched control subjects, identifying disruptions of intestinal metabolism and changes in nutrient utilization in TBI patients that could explain the reduced growth hormone function. Our findings suggest that people with TBI-related fatigue and altered cognition also have different fecal bacterial communities than their control group. This raises the possibility that supplementing or replacing the dysbiotic intestinal communities may help to ease the symptoms experienced after TBI. We hope that our findings will help to focus the collective wisdom of the research community to better understand and treat this syndrome, providing hope for many. Because these symptoms can manifest months to years after the injury, the initial injury, and as this cluster of symptoms hasn't been previously grouped together, it often goes unidentified in the medical community.